By the way, if you are headed to the beach this 4th of July holiday, swimmers beware. You could see fewer lifeguards on duty not only this weekend, but the entire summer. Fewer than half of the nearly 8,000 seasonal federal park positions, including lifeguards, have been filled, according to the National Parks Conservation Association, also known as the NPCA. And at Assateague Island National Seashore in Maryland and Virginia, which is managed by the National Park Service, there are no lifeguards at all. We went there to find out why.
The reason there are no lifeguards at Assateague is honestly a symptom of the chaos and dysfunction that has been impacting this agency since the beginning of this administration.
Ed Storelli oversees the Mid-Atlantic for the NPCA, which says staffing overall for the National Park Service is down 24% since President Trump took office, not including seasonal hires.
It's either because these people have been forced out of the agency through deferred resignations or buyouts, or that they just haven't been hired at all due to the administration's current freeze on hiring.
According to a Trump administration official, all fire, law enforcement, and public-facing park personnel are prioritized to remain in place.
And many lawmakers are demanding answers from the Trump administration, among them Virginia Congresswoman Jen Kiggans. She joins us now. Congresswoman, thank you very much for joining us. You know, we did that interview. Millions of people were out there on the shoreline, and millions go out every single year. We were out there on a very busy day. What concerns you about not having any lifeguards out there?
Yeah, I have a district that lives on the beach in the bay, including the Eastern Shore, and Assateague is one of those national parks that has been impacted. We, as the representative of that district, have pushed back to the Department of Interior. We've written a letter. I had Secretary Burgum in front of me at Natural Resources Committee a couple of weeks ago. We asked him directly, about this this federal worker freeze, that they should not have been impacted. Those workers are exempt. The lifeguards are exempt. So we are working very hard to make sure that they are hired. I know it's now July. Summer is in full throw. We have thousands of millions of visitors that visit our beaches in the Virginia's 2nd Congressional District. So we are pushing back, but we need to get those lifeguards hired. They should never have been impacted by that hiring freeze.
And Congresswoman, I'm curious, the NPCA blames these staffing issues on the ripple effects of what has happened under the Trump administration, including firing federal workers, offering buyouts, and implementing hiring freezes. You've been in support of many of these DOGE federal cuts. Are you still in support now, given what's transpired?
Yeah, we've pushed back numerous times in a couple different areas, not just this lifeguard issue, but also in our shipyards, our public shipyards. We know that that they were impacted. I think it was a mistake. And then also in the VA space, some of the all the providers, the physicians and nurses, should have been exempt. So we've picked up the phone and make sure we've advocated for those positions too. So it wasn't a perfect rollout, but we've done our job as a representative of a district where people were impacted by some of those changes and pushed back.
All right, Congresswoman, let me change gears here and talk about the big, beautiful bill as coined by President Trump. You've signed a letter citing the importance of protecting Medicaid. Does the current version of the bill do that? And have you decided how you're going to vote?
Yeah, so the current version of the bill protects and strengthens Medicaid, and it's a big bill, right? Big, beautiful bill, as they call it. Thousands of things in this bill. It is not perfect. There are parts of this bill that I like a lot more than others. I'm a nurse practitioner by trade, geriatrics, so I provide health care to older adults. I understand very much the implications of when we change things in Medicaid. The purpose of Medicaid was hopefully to provide temporary health care for people who are unemployed, but for people who actually need it, who are disabled, who are in substance abuse programs, who have mental health issues. It's for able-bodied people should not be receiving Medicaid. So we've got 4.8 million Americans who are on Medicaid who shouldn't be on it. And we've seen this growth in the cost of Medicaid and the number of people are on it. And this government handout program that it's turned into this huge, almost machine. The Republicans have tried to scale that back a little so that we can strengthen and preserve it for the actual people who need it. So that's the part I like. Yes.
Okay, so what don't you like about the bill, and what would you say to those constituents of yours who are actually worried about losing their coverage and their hospital access, especially older Americans?
I want to talk about the parts that I like about the bill and why we'll be supporting the bill.
But why won't you tell us what you don't like about it?
Because it gets the biggest tax break in history. Well, I will, and that the Medicaid piece that I just talked about is the part that isn't perfect, that needs to be tweaked. But there are so many other good things, and I get one vote. People need to remember there's thousands of things in this bill. I, as a representative, get one vote, all 435 members of us. The part where we extend that 2017 tax cuts and we prevent a 22% hike in taxes is so important. That's several thousands of dollars for every working family. No taxes on tips, no taxes on overtime, increasing the child tax credit. The security at the border piece. We saw the last 4 years how permeable our border became and the amount of people who came into our country who shouldn't be here and how dangerous it became. And then also there's a $150 billion defense plus up. I represent a big Navy district where we need more ships. We need more aircraft. I need to take care of my service members and their families. We have a lot of money in there for quality of life improvements. So there's some really good parts of this
Congresswoman, it sounds
bill.
like you're a yes on this bill.
I will be supporting the bill because of those good components. There's, again, thousands of things. I get one vote. And although I may not think the bill is perfect and doesn't have everything I want, including some of the health care and some of the Medicaid issues, I understand the repercussions for hospital systems. But I also want people to have Medicaid who truly need it. I took care of those people, and I want to strengthen and preserve that program. And that program has gotten out of control with the cost. So there is some room to continue to tweak it. And we will still be able to tweak this bill even after passage.
All right. We'll see what happens. Congresswoman Jen Kiggans, thank you very much. Appreciate it.